Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. South Korea seems to be over the peak of the Omicron surge. New daily cases have been coming in at around 250,000 for the past few days. We might see under 200,000 when the official numbers are out later today. It might seem like a lot, and it is, let's be honest, but we should also keep in mind that the all-time high in South Korea was over 620,000 on March 17th.
And beginning today, the private gathering limit has been raised to 10 people from 8, and the business hour curfew on restaurants and cafes have been lifted by an hour to midnight. Health authorities are also said to be considering lifting social distancing rules and outdoor mask mandates when the revised rules expire in 2 weeks from now, given South Korea's high vaccination and infection rates. For more, we connect to Dr. Alice Tan, internist at Ms. Mary Women's Hospital in Seoul. Good morning, Dr. Tan.
Good morning.
So firstly, we'd like to get your reaction on the latest revision to the social distancing guidelines. You know, they raised the private gathering cap and extended business hours. What do you think about it?
Well, I think there's no question that transmission rates are going down. There's improvement in what's going on. But we need to remember that we're coming down from rates that were that placed us at #1 in the world for 3 consecutive weeks, and we're still having very high levels of transmission. There are about 570 new cases per 100,000 population currently in our country, which is a very high level. I think instead of putting blanket decreased restrictions throughout the country, we should be taking a more regionalized approach. There are certain regions, I think, that could tolerate these loosened measures, and other regions that are still vulnerable when there are increased transmission rates, just depending on their healthcare capacity overall. And I think we should also communicate very clearly to the public that there may be certain populations for which these loosened measures really should not be applied. For example, there may be elderly people who are at the tail end of their immunity from their 3rd dose. We don't have 4th doses eligible for the greater population yet. And we should communicate that there is a risk involved if people are gathering in large numbers and taking advantage of the later business hours. And also, I think there's also a problem in terms of accessibility to antiviral treatments. It's still very difficult to access these medications. And until these measures are improved, it may be dangerous to have these loosened measures throughout the country.
Right. Well, I kind of have a good idea what you might answer when I ask you this next question then, because when this 2-week period expires, it is thought that there's a good chance that they'll remove the outdoor face mask mandate and also potentially even just lift all the social distancing restrictions. Do you think that might actually happen? And if it does happen, what's your opinion?
Of course, this entirely depends on where we are in 2 weeks in terms of transmission levels and hospital capacity. We would need to see continued sustained improvement in the COVID situation overall in our country before we decide to lift restrictions altogether. Now, I would like to point out that in the UK, the Public Health Authority, they revised their definition of what is a close contact to being within 1 meter of a positive case, a person with COVID, for 1 minute. And if you consider the high population density in South Korea, it may be very, very difficult, even outdoors, to avoid close contact with a person with COVID, with active disease. The other, thing to consider is, unfortunately, 12 million people approximately have gotten infected with COVID recently. They have essentially gotten a booster in terms of their immunity through natural infection. So we may be able to tolerate loosened social distancing measures for maybe a month or two. But as you mentioned earlier in the program, it really does depend on what's on the horizon in terms of new variants. If we have a new variant that poses a significant risk, we may have to pull back right away. And with the current level of transmission being so high, it may be very difficult to control a new variant if it does enter our country.
Now, Dr. Tan, last week, South Korea has permitted the use of COVID-19 vaccines for kids aged 5 to 11, but it seems like only a small number of parents have registered the shots for their children. Why do you think this is so?
Well, first of all, the government has not strongly endorsed vaccination among healthy children between the age of 5 and 11. They have strongly recommended it for immunocompromised children or children with high-risk medical conditions, but not for the general public in terms of that age group. Secondly, they don't recommend vaccination for children who have been recently infected with COVID-19. And of course, during the last 6 weeks, the incidence rate of COVID among young people has been so high, it's almost 50% of that population has gotten infected with COVID recently, so making them basically ineligible for the vaccine. There's also, I think, misinformation in terms of potential side effects of mRNA vaccines in this age group, which are unfounded, and then perhaps lack of information in terms of the risks of severe disease and even death among young children. People think that children are immune to having severe disease, but that's simply not true. Of the 17 deaths that we've had among children and adolescents, 82% occurred in the last 6 weeks. And that's when the Omicron strain was dominant, of course. And so I think it's a combination of all these factors that are attributing to the low sign-up rates for vaccination.
And finally, Doctor, really the $64,000 question. If you just keep your answer brief, we're almost out of time. But do you think eventually Korea and other countries around the world will ever go back to how it was pre-pandemic?
Well, we definitely need to do a better job in terms of pandemic preparedness overall. And also we need better vaccines that are durable, that have broad immunity in terms of cross protection against variants. We also need a better surveillance system in place just in case we do need to pull back after we return to some sense of normal. I think we may just have a seasonal approach, a cold COVID flu season that runs from late fall to early spring, and perhaps it may just be the recommendation for the next coming years to just everyone wear a mask indoors during this season, just to tie us through that acute infectious phase.
Well, that sounds a little bit better than the current conditions. Well, Dr. Tan, thank you so much for your insights. We appreciate it.
Thank you.
Thank you.